Recording. Okay. So, hi everyone, I'm C from the Healthcare Consumers Association, and nice to see a few varied faces here today. And I'd just like to start off by acknowledging country. So for most of us, we'll be meeting on the lands of the Ngunnawal, the Ngambri, or over in Queanbeyan, I believe it's the Narragansett people. And I'd like to acknowledge those traditional custodians and their elders past and present, and pay my respects to their continuing contribution to our culture and of course their custodianship of the land, waters and country that we live on. And I'd like to pay my respects to any Aboriginal and Torres Strait Islander people who are here today as well. So thank you all for coming. As I say, I'm C, and I'm the Health Literacy Officer here at the Healthcare Consumers Association of the ACT, or HCCA as we call it, because it's quite a long name. I've got with me today Sarah Smith from Calvary Public Hospital, who's one of their pharmacists.
Hello.
Yeah. And I mean, Sarah, do you want to just give us a little quick intro about yourself?
Sure, yeah. My name's Sarah and I'm the Deputy Director of Pharmacy at Calvary Public Hospital, and my official job title is Quality Use of Medicines Pharmacist. So making sure that wherever we're using medicines, we're using them in the best possible way.
So a great font of knowledge to back us up here and answer some of your curly questions that come our way. Of course, we can't give like individualized advice. That's not really the job here, but we'll do our best to answer some of those more complex questions. And I am not a pharmacist, obviously. I'm really just a health consumer. So someone who uses the health system and just turn that into a job. I advocate around health and getting the best out of the health system, giving presentations like this to consumers, to community workers and disability workers like yourselves to make things better and improve the way people use the system. So just a bit of housekeeping around Zoom. If you're unfamiliar with it, do let us know if you have any issues. It's good if you can keep yourself on mute using the little microphone button in the corner, just so that we don't get too much background noise. But if you can keep your camera on so I can make sure that you're still engaged and I'm not saying something that's completely off the wall, that really helps me. But if you're having trouble with connection, turning off your camera can help. Of course, asking questions is really helpful with these because we want to make sure we answer all your queries you've got in the back of your head. So let us know. There are no silly questions here. You can pop those in the chat or give us a wave either physically or using the raise hand button in Zoom, and we'll be keeping an eye on that. Caitlin in the chat, Caitlin HCCA is our admin who can help you out. Alrighty, so just making sure that I've covered off all those points. I think we're all good. So I'll jump into my PowerPoint and do flag me down if I need to slow down at any point. Over to my screen. Can everybody see that? Great. And I'll just make sure I can see you as well. Excellent. So that's, of course, our topic for the day. Quick little bit about healthcare consumers is we've been around for about, oh gosh, it'll be 44 years in November. And we are a health promotion organisation. We're a charity here in the ACT, not-for-profit, and we work predominantly with ACT Health and Canberra Health Services, but we do also work a bit with the private health system and different health providers around the ACT to improve services, and then of course educating people in the community. We're a member-based organisation, so anyone using health services can join us, and some organisations do also join us if they share that sort of value as well. So you can find out more about us online, and I'll send out any more links as well. Okay, so a bit about what we'll talk about today, how we'll run this. We'll be talking about what is a medicine first up, because it's a bit broader than I think a lot of people think about. We'll be talking about what generics are and the active ingredients within medicines and that defining that whole issue. Oh gosh, just a few more people. The sort of questions that you should be asking around medicines, and you should be coaching your clients in asking if you can. to help them get the best out of their medicines and understand why they're taking them, the best ways to take them. We'll also be talking about costs, how people can reduce them, some useful tips, and unpacking a bit about things like the PBS safety net. Some things around keeping track of medicines, the tools that are available, and some ways to use them, but also drawing on a bit of your knowledge because it's a bit of an opportunity to share, and a few of the guidelines and resources that are out there to help you in your work as we go. And as I say, stop us at any time if you want to dig into something a bit more. So just to give us a bit of foundation of health literacy, why we do this and what I do day to day, is we are talking about health literacy to boost the knowledge, skills, capacity, and motivation of people out in the community so that they can understand what is going on in the health system and engage with it better. So your role as a community worker, or in, say, a counselling service, as we've heard from one of these, could be to support your client by sharing the knowledge you learn here today, or improving their skills by connecting them with resources, supporting their capacity if you're a support worker, that sort of thing, or motivating them to engage with the health system in a certain way. And we need all of these components to engage better with the health system. And that's really what my role is all about, boosting these components for people. So that's sort of a bit about what I'm doing in the academic motivation for these talks. So I just wanted to give you a bit of background on that. And there's a whole health literacy project that we've done, and I'll include some links to the Canberra Health Literacy website, which has further resources on topics beyond medicines as well. Okay. So to kick us off, what is a medicine? It might be a little broader than you think, because a lot of us just think about our prescriptions or our over-the-counter medicines, things like Panadol that you pick up from the shops, but it really covers prescribed medicines, over-the-counter, your vitamins, mineral supplements, those sort of things, but also some natural health products, traditional medicines that some people might not think of within that category, and complementary medicines. And it's really important to think holistically of medicines because they can interact with each other, and that can be a common cause of things like interactions and what they call adverse events that can land people in hospital or back at the doctor's office when something goes wrong. If we look at things like the different forms of medicines, there's a whole range. So tablets and capsules and liquids and nasal sprays and injections. But also, if we think about things like those natural therapies, complementary medicines, the herbal medicines, things like that can come in some odd forms. Same with supplements and vitamins. They could be dissolvable. They can be, your fizzy, chewable sort of things. So it can be quite a diverse range of things. And it's just important to remember that it could be a whole range of different forms there. Sarah, did you have any comments on the diversity of medicines?
Yeah, like it's huge. And what we see mostly in the hospital is people will come into hospital, and one of the first questions they will get is, why are you here? And then the second question is, what medicines do you take? And when people are stressed, when they come into hospital, they're really good at telling us, yeah, I take this tablet and this tablet and this tablet. But the things that are harder to remember when you're a bit stressed are things like the herbal supplements and the vitamins that you talked about. We sometimes, we do a lot of information gathering with patients when they come in, and we say, do you have anything that you keep in the fridge? And they say, oh yeah, my insulin. So it's trying to get out of that mindset of medicines aren't just tablets. We're also interested in things like, do you take recreational drugs? Because sometimes, not that we want to, be punitive or anything, but sometimes that can actually have an impact on your admission as well. So when patients do come into hospital, we spend a lot of time with them going through and trying to find absolutely everything that might have impacted on why they're here in hospital, and for things that we can, try and make some changes to maybe help with the current illness. But yeah, try and think of everything as pretty much a medicine. Yeah.
So as you can see, a fairly broad category. So I might just stop for a moment and check in with you all. to just have to think about, and without identifying anyone in particular, but how many of you have clients that take, say, medicines every day and take multiple medicines? Show of hands, or you could chime in. Yeah, got a few. Yeah, taking multiple medicines, that sort of thing. Yeah, so I can see a few hands. And does anyone have experienced something where someone may have taken the wrong medicine or had a bit of a mishap? Not getting any hands there, but oh, we've got one hand. You don't necessarily have to tell the story if you don't want to, but it's just.
Well, I'm quite happy to tell the story. It was at my son's under our care now, but when he was in group homes, there were several occasions where the staff and the managing staff just didn't understand what was what. The Webster packs, they lost Webster packs, they confused things, confused an aspirin with a lorazepam, that type of inexplicable behaviour. And then when you address your questions to those who are meant to be managing the arrangements, they couldn't understand the difference between a PRN and an STA, etc., etc. So, yeah, it's rife in those institutional environments, I find.
So that's something that we might want to ask about, is that sort of terminology as well, a bit later on if you'd like, because it's not something that's necessarily trained at that level, I think, but it's and yeah, there are stories like that out there where the mishaps can be quite common. So it's important to talk about them and not necessarily be ashamed when they do happen, especially if people are self-managing, they have an accident. It's important to talk about it and debrief a bit so it doesn't happen again. All right. I just want to dig in a bit to the stats as well around these mishaps, because I think we know that medicine sort of accidents and mishaps are a bit more common than perhaps you might think. So some of these statistics are a bit older. I've tried to update these, but COVID has made it a bit hard to find new data that's useful. But with the statistics around this are around 20 to 30% of hospital admissions for older people, so over 65s, are related to their medicines in some way. So taking the wrong pill or taking a double dose, that sort of thing. It's a fairly common occurrence. And we know that there are big bucks spent on medications, about $19 billion each year back in 2014 or so. And I know that just on the PBS, it was about $15 billion in the last financial year. So it's an enormous amount. So if you're taking the wrong ones, or if things could be better, that could be an awful lot of wasted money. We also think of things like car crashes quite a lot. But if you look at the hospital admissions, this data is from 2014, so quite a while ago, but we were looking at around 53,000 admissions for things like traffic accidents versus about 230,000 for medicine issues. So it is quite a common issue, which is why we really want to talk about it more. And Sarah, do you want to comment a little bit on how often you see these and what are some of the common things you see?
Yeah, sure. You mentioned, I just want to go back, you mentioned you haven't been able to find recent data. I've been looking at data like this for about 10 years, and in 10 years it hasn't changed. Like, those numbers just seem fixed. 20 to 30% of all admissions are due to medication. So I don't think updating them, I think you get the same numbers, which is really sad that in all this time we've been trying to work on it and not much has happened. And also, I guess when you think about it, like, where do you ever learn this stuff? Who teaches you the difference between a brand name and a generic name? Who teaches you, how to find the active ingredient on a label? So I guess that's, why you guys are all here. And I'm hoping that you'll come away with some really, important knowledge that it can be hard to find in other places. Exactly what you said, we see people who are maybe accidentally taking too much medication. So potentially they have got a brand and a generic mixed up and they're taking the same thing twice. That's fairly common. We also see people who aren't taking their medication or aren't taking their medication properly. So a lot of patients will come in winter where their asthma is flared up, and we will sit down and have a chat to them and find out that they're not using their inhalers properly, because those things can be quite complex to use properly. And we'll spend a bit more time sort of with them, training them in how to use their medicines properly. We have issues where perhaps someone's been prescribed a new medicine for like a short-term condition. Maybe they've got they need some antibiotics short-term, and that medicine doesn't mix well with their regular medicines, and that's caused an admission to hospital. So huge range of issues, but we're very lucky that both major hospitals in Canberra have dedicated emergency department pharmacists, and it's basically their job to do that information gathering when someone comes into hospital and find out, is medicine the reason that this person has come into hospital, and then do something about it.
Well, thanks for that. It's, yeah, as you say, it's still quite a large problem even after all this time. It hasn't changed. Okay. So what can we do about it? Well, learning, of course. So I will start with generic medicines here. So generic medicines, as Sarah said, one of those things is knowing the difference between generics and brands is quite a useful thing to do. So generic medicines, which you probably have heard about, are essentially copies of brand name drugs that give the same sort of dosage, intended use, effects, and usually have this, well, they would have the same side effects, the same route of administration, risks, safety, and strength of the original drug, but they're usually cheaper, which is why people would opt for them. And that's, apologies, just lost my train of thought there. And the reason people get them confused because they often have different brand names and the packaging looks different. So I will move to, it's really important that people know the active ingredient in their medicines, and it's shown on the packages. More and more we're seeing standardized packages sort of be usually in the same place or on the same place in the medicine labels. But of course their strength in medicines can vary, and it's important to make sure that you know how to read those. And of course, in some medicines, there's more than one active ingredient, so you need to look for those. So one of the things you can do is if you know the brand name, but not the active ingredient names, you can look it up using something called MPS Medicine Finder, which I can show you in a moment. So can you all still see the PowerPoint, or I will just...
No, I can see the website.
Right,
yeah,
excellent.
Yeah.
Great. So if we jump into Medicine Finder, if you've got a packet that you can't read or it's just a bit confusing for you, this is a really great tool to find out all the information in a standard form. So if we think of a brand name drug, does anyone want to call one out? Go on. Or I will pick one off the top of my head. Let's try Nurofen. And we'll just pick, say, Nurofen Plus, and let's find out what the active ingredient is of this one. So it will come up, and you can search even if you don't know the specific one, just the brand. And when you get to MPS Medicine Wise, it will give you, right up the top, the brand name, the active ingredient, and a little bit more information about where you can get the consumer medicines information, which is a leaflet of standard information about side effects, that sort of thing. So what we can see here is that brand name, Nurofen Plus, which is what we're looking for. And this one, good example, I guess, has two active ingredients, ibuprofen and codeine phosphate hemihydrate. So that way we can check what's in it, check it against some of our other medicines. And if you search a few at a time, you may be surprised to find that you have two on hand that have the same active ingredient. So it's a useful tool to double check if you have brand name products or even a generic product that you're just unfamiliar with, that sort of thing. So that's the first useful tool to have on hand, if I can get back to my PowerPoint. Okay, and Sarah, I'll get you to speak to the next few slides if you can.
Yeah, no worries. So I hope that made sense. So all medications will have a brand, and then they will have an active ingredient. And then we will make copies of the original brand, which we call generic medicines. So this is some photographs that I pulled off the internet during the height of COVID. And this was just after the health minister did a press release. And he said at the time, if you're home and you're going to get COVID, you should put together one of these COVID packs, and you should have a box of Panadol at home. And so this is a photo from clearly a chemist warehouse. And these empty shelves here are where all the Panadol was on the shelf, and you can see it's all been wiped out. So everyone's listened to the health minister, they've come in and they've got their box of Panadol. Over here, these orange boxes is a box of medicine called Panamax. Now, Panamax has the active ingredient of paracetamol, as does Panadol. So they have exactly the same active ingredients, they're exactly the same strength, but you can see here all the Panamaxes are left on the shelf, and I wonder if that's because people didn't know that Panamax and Panadol, they're two different brands, but they have the same active. And so people were going, oh, there's this massive shortage of Panadol, we can't get Panadol. But whether they just didn't know that Panamax was a generic brand of Panadol, it does exactly the same job. And maybe they walked out of the pharmacy without their essential part of their COVID isolation kit. So yeah, I thought that was a good example of people maybe not understanding the difference between brand and generic. So Panadol is the brand, paracetamol is the generic, and there are a million copies of Panadol as generic medicines. Yeah. And then I guess this slide was just kind of to highlight, we see this quite a lot. And we know at the moment medicines do go in and out of stock. We have a lot of trouble with medicine shortages at the moment, where maybe we can't get a particular brand of medicine. So this slide shows 4 different brands with the exact same active ingredient. So you can see we've got Zoloft, Cetona, Eleva, but the active ingredient in all these medicines is sertraline 50 milligrams. So Zoloft is the original brand, and all these others, the Eleva and the Cetona and the Sertra, these are all what we'd say generics of this brand. But they are all exactly the same active. So what we see sometimes is that a patient or a person might be on Zoloft, and suddenly the pharmacy can't get Zoloft, so they decide to substitute the patient to the Eleva. Now, Zoloft and Eleva look very different. They almost look like they could be actually 2 different medicines. And what we do see occasionally is that people end up taking the same thing twice because they don't understand. They think Eleva is a different medicine, and don't understand that it's actually the same active. So they end up taking the same thing twice. And I think I've even seen someone take the same thing 3 times. So this is where it pays to really know the brand, but also to know that the active ingredient, to make sure when you're looking on the box that the same thing hasn't been doubled up, because we do see that quite a bit. And I just kind of wanted to go back to this idea of generic medicine. So I've heard generic medicines described as like the home brand version. And I just kind of wanted to say that's not 100% true. So if I go to Coles and buy, Tim Tams versus home brand Tim Tams, I expect that the home brand ones, maybe the chocolate's not as good a quality, and maybe they are a bit more crumbly and they taste a bit funny. That is not the case with generic medicines. So by law, generic medicines have to act in exactly the same way as the original brand. They won't get registered to be used in Australia unless they've gone through all the studies to show they're absorbed in exactly the same way, they give exactly the same levels in the blood, they have exactly the same side effects. So a generic medicine is not a second class medicine, it's not a home brand medicine. It does have to be proven to be exactly the same in order to be registered. And I just wanted to show you this slide. So there's photographs of 3 different tablets. One of them is called Luvox 50 milligrams. That's the original brand of a medicine called fluvoxamine. The next one down is a generic of Luvox. It's called Movox. And as you can see, there's something funny about these tablets. They look exactly the same. And that's because the company that makes the brand also makes the generic. So they're made in exactly the same factory. They're exactly the same tablet. They're just packaged as a generic. So for example, the hospital would pay about, I don't know, $9 a box for this top one. We'd pay about $6 a box for this middle one. Now, the bottom tablet is another generic made by a different company, and you can see here it's actually a different color and it's got a different, some different markings on it. And so this circle over here shows how generics might differ. They have the same active ingredients, but they might just have slightly different, we put things in the tablet to help it bind together. So they might have a slightly different binding agent. They might have a slightly different coloring to them. They might have a slightly different preservative, but none of that actually affects how the medication works. It has to,
Sarah.
again, been shown to be the same. Yeah.
Sarah, sorry, we have a fantastic question in the chat that I'm sure you have a nice answer
I have
for us.
just said that. Yes.
Yeah.
So yeah, look, there are often good reasons why doctors don't allow brand substitution. One of them, I think, would be if they are concerned that their patient might get confused. So if the pharmacies are constantly chopping and changing brands, and my patient was getting confused, if I was the GP, I'd throw my hands up and say, no, please only give my patient this brand. There are some fillers that we put in tablets that some people might be allergic to. So this one down here obviously has some sort of yellow coloring in it. Perhaps that patient might be allergic to that yellow coloring. So there are good reasons why you might choose a brand over a generic. I use the example, I get migraines and I take migraine tablets. One of them comes as like a wafer and one of them comes as a dispersible tablet. They work exactly the same, but the wafer just dissolves a lot faster and tastes a lot better than the dispersible tablet. So I always ask, can I have the brand and not the generic? Because when you've got a migraine, you just don't want it to taste awful. So there are some reasons. There are also some medicines that, while they have the same active, don't quite work in the same way. So there's a very specific subset of medicines where we only want you to use one brand. If you've got epilepsy, if you take warfarin, and if you have some biological we call them MAB injections, there are very good reasons why you might need a particular brand. So often the doctors have a good reason behind it, and it's worth asking them why. Sometimes they don't, and it's definitely worth asking why. In my particular case, are you recommending that particular brand, and getting full transparency over it?
And another one that I've also heard is that some capsules still contain gelatin, and for
Yes.
people who need a halal diet, that's one thing to ask a doctor about as well.
Yes, we often are asked to do searches for things that don't contain gelatin. Yep.
Yeah, we've got another couple of questions in the chat. One of them is around the is there any variation in quality of ingredients between the country of manufacture?
Yeah. Like I said, everything goes through the Therapeutic Goods Administration, the TGA, and there is, a small variance. Each tablet is allowed to vary by, the amount of active within a set guideline, but they do all have to pass the TGA testing, and if they don't pass, they won't get registered. And you're right, maybe a reason why doctors would stay with one brand, I'm not sure, but certainly in the hospital, we choose the cheapest, because the more money we save on medicines, the more money we can give to extra nurses. So we will, if there's not a good reason, we'll find the cheapest one on the market, and we will only stock that brand. Yeah.
Right. Thank you. Are there any more questions on that one?
But I guess I just wanted to say it's also your client's choice. So don't ever feel railroaded. Yes, generics are cheaper, but do understand that clients and patients, and I know I've done it myself, often have a good reason for wanting to use a particular brand. So make sure that that's explored as well, and don't just push generics on people, because they are cheaper. Yeah.
And that's a really critical point about it being a choice.
Yeah.
Okay. So I just wanted to stop for a second now. We've talked about all of that, and look at a medicine label. So this is a fairly standard one, and could anyone here tell me which one is the brand name of this particular medicine, looking at it. You want to chime in?
Is it Teltartan?
Yeah, there we go. And where did you look to grab that? Was it super obvious?
Yeah, printed on the box, whereas the pharmacy label has the active ingredient with the brand name next to it.
Great. Yeah, so that's generally how people look. But on the standard pharmacy labels, of course, these days the active ingredient is listed first, and then the brand name will be in brackets, as these were standardized most recently. So as you say, on the box, and that's where most people look, but the pharmacy label is usually the more reliable way. Sarah, did you want to chime in there?
I was just going to say, usually the brand name's the one that's easy to say. It's usually the really big one, and it's the one you can actually pronounce. Some of the active ingredients tend to be a bit of a mouthful sometimes as well. But we definitely are happy to spend time with people teaching them how to pronounce their the active ingredient as well. And they often say pharmacists only go to conferences to learn how to pronounce some of the new drugs that are on the market as well.
Absolutely. And then, yeah, I've just pointed out that here's the active ingredient and the instructions on each label, and they've now been standardized in most places, and there are some pretty solid guidelines around them, whereas previously things were less standard. Okay. And so this is a diagram of a typical consumer medicines information pamphlet, which I briefly mentioned when I showed you the medicines finder information earlier. And these are available for all your standard prescription medicines under the PBS via that MedicineWise site, which we'll go back to in a moment. And they contain all the standard information around your brand names, your active ingredients, and things like what to do if someone misses a dose, what to do if they have leftover medicine, as some things need to be disposed of specifically, how to store it, interactions with other medicines and other things people might be taking. So some medicines you can't eat certain things with. Active ingredients and other fillers will be on this information, and the contact details of the pharmaceutical company. So,
I was just going to say the other thing that's on there next to active ingredient now is actually the phonetic pronunciation of the active ingredient. So sometimes that can help as well if you want to know how to pronounce something. Next to the active ingredient in brackets, they'll have the phonetic, how to say it broken up. So that might help, Janine, if you wanted to use active ingredient names. It actually tells you how to sound it out on the CMI as well.
Yeah, and I was about to say we can jump to an example. If I go to the MedicineWise page, just pop back to Medicine Finder. Let me think of a good one. Like suppose a fairly common medicine would be that's an SSRI that a fair few people take. And if we look at tablets for that medicine, you'll see it's got the brand name, active ingredient. If we scroll down, it's got consumer medicine information. I also like that they have large print in all of these for those folks who need it. And if we hit the medicines information, all comes out so it's printable. Clearly I've been here before. And yes, as Sarah says, it's got the name, Lexapro, the brand name, how to pronounce that, and then the pharmaceutical name. So escitalopram oxalate, which is very useful if you've got to say it to a pharmacist.
Well, look, we will know what you're talking about if you say the brand name, but yeah, if you did want to go that step further and start to learn the actives, that can just be one way. And it takes us practice too. There's still a few that I don't say very well.
There's some very complicated ones out
Yeah.
there. But yes, as you can see, this information is standard across all of them. So especially if you're looking for things like what you can't do, what you need to keep track of, what it's used for, all of that will be available in these documents. So any questions around what we've just talked about with consumer medicines? And I will switch back.
was going to say, has anyone ever read one of these? They're pretty hard going a lot of the time. We are doing some work with the TGA to try and get, although they're in a standardized format, they're not a patient-friendly standardized format. So we are trying to get these in sort of client-friendly information and have the information actually mean something, because they can be very generic and very vague, which is done deliberately because they are written by the manufacturer, so the drug company. So they are good for a bit of baseline, but they don't often just quite hit that extra that some clients need. The other thing we find with these, and I don't know if you find the same, you kind of skim over the first few pages and all you want to do is go straight to the list of side effects. And sometimes these can have, 3 and 4 massive columns of side effects, and that can be really confronting, particularly when you're just starting a medicine. Because they are published by the manufacturers of the medication legally, they kind of have to put every side effect that almost everyone has ever experienced on there. So when you are reading these, and if you've got clients reading these, I just really wanted to reinforce, if you are getting concerns about the side effect section, make sure you talk to someone about it, because it's highly likely that most of those side effects you'll never even see. But they do have to be on there legally. Yeah.
We have another great question about translations of these information sheets.
Yes, on the MPS website, quite a lot of them you will find translated. They do a lot of translated information, and for all our high-risk medicines, we certainly have translations in multiple languages. So your doctor or your pharmacist should definitely be able to access them for you if you can't find them on the NPS website.
And
yeah, it's a good point about the disability access. Yeah, we can print them as big as our clients need. And if you do download them from the website, but yeah, certainly the ones they put in the box, I don't know how anyone can read them. They're tiny. So if you do need a bigger one, the pharmacist certainly can print them out much bigger for you.
And if I switch back to the MedicineWise site, there is a summary under each of these of some of the key information. It's not the full thing, but it's usually a bit more readable for folks who can't get through that enormous amount of information. It'll also highlight what you should really go to the doctor for if you're worried about it, rather than giving you that full list of quite confronting side effects. I know that the Lexapro one has some pretty confronting.
Yeah, looking at that, like who would ever take that medicine? So yeah, that's why that sort of has to be read in conjunction with your healthcare provider, and discuss those risk benefits with them. Yeah.
Switching tabs. There we go. Okay. So good time to transition to questions we should be asking. And that's questions that we should be asking as people who use medicines, and that we should be coaching people on asking their doctors that we work with. So we've talked about brand names, active ingredients and generics, and those discussions should really be had with their doctor and with their pharmacists about why this particular brand name, if that's the case, and those sort of details. But some of the other questions they may want to ask are things like, what is it for? Why am I taking it? Because that, of course, helps people understand how long they'll need to be taking it and what sort of they're looking for to change. When and how should I take this medicine is a really important one to get the full detail on, because as you saw earlier, those pharmacy labels aren't always as detailed as they might need to be, particularly if it's not just taking a tablet. It could be more complicated and it might not be as understandable as it needs to be. What are the benefits of this medicine? So what changes should people be looking for? Is it something that's going to be relieving pain, that sort of thing? Is it going to be clearing up this infection? What's going to be the improvement that they're looking for? What are the possible side effects to look out for, particularly those ones that they should be coming back to the health provider for? What are the ones they should be worried about? Or are there ones that they should be concerned about with interactions with existing medicines, particularly if they're taking a lot? And then if they're concerned about things like the side effects or risks, what are the other treatment options they might be able to look at? Because if we're looking at the things like chronic conditions, there might be things like lifestyle changes they could do as well. Another question that I haven't got on this slide, but is also good to ask, is what happens if I don't take this medicine? Because some things like, say, cold and flu do clear up on their own, and taking a medicine might not be that beneficial, and might just be just a potential side effect waiting to happen for people. But of course, there are some that you really do need to take the medicine to get better, and asking that question can reinforce that. All this is to say that it can be very difficult to ask these questions. So giving people a list like this can be quite helpful. And I will quickly show you that there is an existing pre-prepared sort of list of questions on Health Direct. And all of this will be in the resource sheet I send out after the session. This is a really good one for people to take along. You can use the question builder on this Health Direct website that people can find on the front page to build out a list that they take to an appointment. But also all of these questions are on the page about what are the likely benefits, what are the side effects that they should be asking about, what would happen if they don't take it, those sort of things, so that people can understand what answers they're looking for. And that's a really useful resource to equip people with, and also understand yourself why you might need to assist people in taking their medicines. Okay. Were there any questions about that? I will dig into a couple of these questions a bit more in a second. There's a few things in the chat. Right. So one of the questions that is good to dig into is, what side effects do I need to know about? So it's really important to acknowledge that all medicines can have side effects. All of them do have some kind of side effects, really. And you want to weigh up those possible side effects against the likely benefits. And that's what people will need to do in discussion with their doctor. And also be aware of the interactions between medicines. So you can read that consumer medicines information, but as Sarah has highlighted, it's really good to do that in conjunction with your pharmacist, with your health professional, and use that medicines finder to look across the different ones people have, particularly if they're taking a number of medicines. And the other, apologies, I just lost my train of thought. Does anyone have any thoughts on what other questions they could ask around side effects, or encourage people to ask around that?
Maybe, should I stop taking the medication if I have side effects?
That's a really good one. Yes, yes. So it's really good to ask what you should do if you experience them. Sarah?
Yeah, I totally agree. So it may be that you experience a side effect in the short term, and so it might be a little bit uncomfortable for a while, but then the side effect will resolve. It may be that it is really important for you to continue taking this medicine, so we might give you something to manage the side effect until it's resolved, or it might just be that actually, no, that's not something that we want to continue with. We actually want to try another medicine. So there's not just one medicine for every disease out there. There's a huge range of medicines these days, and often we do have to play around a little bit to get it right. And a side effect that's annoying for you might not be an issue for someone else. So it's really important to keep that open communication. Ask what to do about it, know when to report it. And if you are going to stop something because of a side effect, let us know. Because like I said, often there's something we can do about it. We just need to know about it, rather than people just suddenly stopping their medicine, which can often have unintended effects as well. Yeah.
And it's one of those things that you may want to be able to track when you are thinking about tracking how you take your medicines and how often, is also tracking side effects. So that's something to discuss with doctors. Do you want us to track these if I'm not coming back to you straight away? That sort of thing.
Yeah.
Another question that I've highlighted there is, how do I take the medicine and for how long? And it's one of those really important questions. So knowing how to take your medicine can get quite complex. So whether it's one that you just swallow the pill, but do you chew it first, or do you have to swallow it whole? Do you have to take it with food? If it's a liquid, do you need to put it in something else and then sip at it, or drink it straight away, or whole thing at once? Is it a lozenge that you dissolve? Do you need to crunch it up? Do you rub it in? Do you inhale it? Insert it somewhere? That sort of thing, because you really need to, of course, take your medicines as directed to get the full benefit, but those directions need to be clear, and you may need to help someone to understand that. Those directions on the medicine labels can be quite simple, so it needs to be explained by a doctor or by your pharmacist. It could be getting written instructions, pictures, or videos. I know that for some of the chronic conditions like arthritis, for example, they put out videos helping people understand how they might inject their medicines and do that. So those are sorts of things, and people need to discuss concerns about how they're administering their medicines if they're worried, because those sort of mishaps, particularly around things like injections, can be really consequential.
Yeah, there are some amazing things on the internet, videos and things, and things put out by patient lobby groups and stuff. So there are some really good stuff from actual people who take these medicines themselves on the internet. And like I said, if you're not using your medication correctly, it can lead to side effects. So we see people not using their inhalers properly because no one's really shown them, and then they're getting thrush because the medicine's sitting in their mouth instead of going down into their lungs where it needs to be. The other thing I wanted to say is, some tablets and capsules are really, really big and can be really hard for people who might have swallowing difficulties. There are a gazillion ways we can actually, crush and modify medicines, but it's always a good idea to check with someone first, because there might be some tips and tricks we can give you if you do need to, crush or break up medicines to get them into your clients. And the pharmacies have some really good, they can print you off exactly how to do it, because it is different tablet to tablet. You can't just always just crush them up. So yeah.
And I know that some of the medicines that I've taken in the past, I've been given tips around, take something, when you take it, eat something with a bit of fat in it first to line your stomach, that sort of thing. And those sort of tips can be really useful to help people stay on a medication as long as they need to be on it. The other part of this question is, of course, how long? Understanding whether it's a one-off thing, whether it's over a day, a week, a month, especially sometimes things like antibiotics might come with more in the pack than you need to take necessarily. So you want to know how long someone needs to take that course for. And then some medicines are for indefinite, and that needs to be clear when someone starts that, so they understand the full implications. So really important that people understand that how and how long of those medicines, and get those instructions in a way that they can understand. And in addition to what Sarah said about some of those consumer lobby groups, there are also translated resources out there as well. I don't think it's on the fact sheet already, but I can also send out Health Translations, which has some great ones. Just to make my point about labels being confusing, this is just a few that we've gathered. So could anyone tell me, one moment, if there's any questions you would have about that first label there, how you might apply that? What would you assume about it or ask? Anyone? I could.
It seems
Sorry.
you go. I was going to jump in, but you go ahead.
I was going to assume that the first one you would take in the morning and the night as twice.
I think the apply is a bit broad.
Yeah.
Yeah, where are you going to apply it?
How do you apply it?
Yeah.
Yeah.
Is it morning and noon, or is it morning and bedtime, or is it morning and dinner time? Because twice a day means lots of different things to different people.
Exactly. Does it need to be evenly spaced? One of the other things is, so it's a cream, so apply to the skin. But one of the questions that I've had in the past is, do you need to wash your hands afterwards so it doesn't get on anything else? Is it okay to use your hands? Do you have to use a tool? That sort of thing. And how much do you need to apply? If you look closely at the label, it tells you in grams, but what does that actually look like practically to people? That sort of thing. So these are all the sorts of things that you could talk through and get demonstrated if you know to ask, or tell someone that it's okay to ask, that sort of thing.
And I just wanted to reassure everyone, you would never get a label like that coming out of the hospital. We've done a lot of work, and it's now become a national standard that twice a day will be killed off. You'll never see twice a day on a label. Hopefully in the next few years, we're moving to what we call explicit instructions. So yeah, that would read exactly, rub in 1 centimeter to the nose. I think this is a nasal ointment to the nose in the morning, and rub in 1 centimeter at night. So we are moving to this very explicit way of doing medicine instructions. It might just take a little bit longer to catch on in the community. Yep.
Yeah. I would love to retire this slide.
Yeah.
Like,
yeah. Yeah, it might just be a little while. It has become a national standard. It'll just take a while for people to be able to meet the standard. Yeah.
And I do keep getting hilarious examples sent to me.
Yeah, I've got some great ones too. Yeah.
And for the second one, could anyone think of some questions you might want to ask about this one, or particularly framing it in terms of someone who might not have a very high level of literacy, maybe?
What does instill mean?
Number one.
Yep.
Absolutely.
That is a very good question.
Yeah.
I feel like they've capitalized the wrong words.
Yeah,
I think
we've
2
done,
drops
yeah.
3 times. Like,
Yeah, our new standard is that if we wanted to do 2, we would use a number 2, because a number 2 is much better understood by the clients that we did our research on. And we wouldn't say 3 times a day, we'd say in the morning, at midday, and at bedtime. So there is a lot of data out there saying that capitalizing doesn't help people read, and also don't spell out the numbers, actually use the actual numeral as well. So you'll start to see that a lot more. But it's a bit of a mind shift for some pharmacists. And when we had this, we had a big fight about the word instill, because it was just so ingrained in people that instill is what you do with eardrops. We say put 2 drops into the right ear, but it was a bit of contention that people wanted to just hold on to that instill, and we had to say, well, put sounds a bit funny, but that's exactly what people need to do. They need to put the drops into their ears. Yeah.
While we're here talking about language, are there particular terms that you've seen on labels or on instructions that you want to ask about while we've got a moment, folks? I know that Greg had a couple.
Well, there was one that I'm not sure we addressed. I was sort of absent in my mind for a minute, but there seems to me to be emerging data that people on the spectrum, or with ID, or a range of non-neurotypical people, have very different can have very different reactions to medications like diazepams, benzodiazepams, and anti-hallucinogens that my son's been on. And from what I understand, there's some emerging data in the US showing that it not only varies between neurotypical and non-neurotypical, but within the non-neurotypical groups, you get wide variation in how, or so-called paradoxical effects, as my son has benzos. Doctors seem reluctant to, GPs anyhow, young GPs seem reluctant to accept this or hear it, even though our psychiatrist, who's quite young and respected, thinks there's some legs in the argument. So.
I think that's a really interesting point, Greg, and it probably comes back to, when we do clinical trials on these drugs, we probably don't do them in people with ASD. They probably don't meet the criteria to participate in the clinical trial. Therefore, we'd never find out how they do experience side effects differently. What I would encourage though is if you do have clients who you think are experiencing a side effect that maybe isn't in the leaflet, or the GP, doesn't seem to understand, you can self-report these to the Therapeutic Goods Administration yourself. And I can probably, when we send out all the emails, that you can definitely self-report to the TGA a side effect. Your pharmacist or your doctor can do it for you, but you can also self-report. And the more of those reports that the TGA gets, the more they go, maybe we need to look at this a little bit more closely as well. So I can send out some information on how to do that. I think that would be a really valuable thing. Yep.
There was meant to be a study, at least some sort of a study at the University of New South Wales by the New Zealand and Australia College of Psychiatrists that was about medications at least, and other treatments to do with people on the spectrum. I don't think anything came of that. There was kind of a scoping study, and they were then hoping to get some money for a wider study. But I think it's something, I respect your request that we self-report, but I think it's
it's hard.
Yeah.
When do you do this? Yeah. I will look and see if I can find that study, and I am going to make my
Well, I'm not
pharmacist
sure it ever
have a
became
look
a
at
study
it.
because I'm
Well,
not sure
what happened?
Yeah.
Okay, I'll see what I can find. Yeah.
On a sort of related note, we've got a question from Claire about are there certain drugs that can only be prescribed by psychiatrists?
Yes.
Short answer.
I can't tell you. Short answer is yes. There are definitely particular categories of medications that can only be prescribed by certain doctors, not just psychiatrists. Obs and gynae. There's different doctors, but yes, and something like clozapine that you might know people on definitely is sort of as a psychiatrist only medication. Yes. And that's because they are so specialized and so high risk that they limit them to those particular specialties. Yep. Occasionally there are medicines that can only be started by a psychiatrist, but then once your client is stable, then it may be able to be then prescribed by the GP ongoing. But yes, there are definitely certain categories of medicines that are limited to certain specialties. Yeah.
Is that a hand?
I just saw your hand. Yes.
Yeah, could I just say that, with all respect to our medical system, it's had some big problems at the ED department in Canberra, particularly at the campus in Woden. And, we basically keep on our private psychiatrist now, who's young and able, largely to protect us from doctors who see my son's behaviour as atypical and therefore needing antipsychotics and other things, and very reluctant to listen to behavioural explanations with things like, oh, but we haven't got the data. My wife is a school teacher. I'm a retired academic social scientist, and we tell them we've got 20 years of data. We've got the self-reporting, and the number of times we've stood in ED and argued the toss about the cause of his issues is really quite distressing. So we basically keep on the private psychiatrist now. That costs about $1,000 a year, so we can have their psychiatrist ring him and wind back what they prescribe usually. That's happened at least times with us in the last 5 years. So it's a concern. In spite of the Royal Commission, in spite of the education happening at TCH, it's still got a long way to go.
Yeah. And just those questions that we put up before about asking, that's kind of new to the medical side of things, having patients ask you questions like, how long should I be on? Like, I think it will take a bit of time for the medical system to adjust to this.
Well,
patient empowerment. I think it's happening
with academic life. I mean, I've been an academic.
Yeah, I know.
Yes, if I objected to my students or other staff asking questions, I'd be in strife.
Yeah.
It's a culture.
It's why only part of my job is talking to the community, and the other part is the other side talking to the health services about pulling that forward. But Greg, certainly if you want to discuss how we can move some of that forward in the ACT, you and I can catch up after this as well.
Well, one idea put forward by advocates is to have a social worker on duty 24/7 at ED, so they act as the intermediary and the interlocutor between parents. And you meet some sympathetic younger people, doctors, others just don't want to hear it. But yes, I'm happy to talk about that. See?
Yeah, certainly. We'll catch up. Excellent. All right. Just keeping an eye on the time. Apologies. So moving forward, I probably won't spend too much time on this because there is a wealth of information out there. But when you're working with folks, a lot of them may have questions around costs, how they can save a bit of money. We do a whole talk around saving money, and the sort of consumer-facing version of this spends a bit more time on it. But a bit about costs is that people may have questions around the PBS safety net and how that works. So I do need to update the amount on this because it has changed by 20 whole cents. And but the PBS safety net, basically, if you spend over a certain amount per year, your medicine costs become reduced. And a key thing to remember here is that if someone is part of a family, they can get their amounts for the PBS combined. It's really helpful if someone is seeing the same pharmacy for their whole family to get them to keep track of it. Otherwise, they will need to have a prescription record form, which a link will be available for you all so that people can keep track. And then they can receive a safety net card to reduce their costs. If they're a concession card holder, it becomes free. Otherwise, it's $6.80 for a general prescription, which is great. So,
And I think the annoying thing about this is the onus at the moment is on your client to keep track. So if you do go to different pharmacies, they don't all talk to each other, and you have to prove that you've spent all this money at all the different pharmacies. It's not like the Medicare safety net where, where suddenly if you spend a certain amount towards the end of the year, the rest of the things are appointments are subsidized. With this one, the onus is actually on the client to keep track, and we are definitely pushing the government to try and centralize it like the Medicare safety net, so that you could turn up to any pharmacy and suddenly you've reached your threshold, and from then on it'll be free, and that will all be managed centrally. But for now, if you do go to multiple pharmacies, which makes sense that people do, you just have to keep a track of every prescription that you've had filled, and then once you reach on your form, once you reach the limit, one of the pharmacies will be able to then give you the safety net card. Not a great system for consumers at the moment. Yeah.
But that's why I include that information here, because it is such a huge system that all sorts of people get these questions out in the community around how does this work, and that's the brief rundown.
And if this is new information to you, you can actually go back to a pharmacy. If you had something dispensed in January, you can go back and they can add all those scripts to your form as well. So it's not like if you didn't do it at the time, you've lost it. You can go back to all those pharmacies and get them to print out your stickers for you. Yeah.
And one thing to remember for this year is it's not too late because it is per calendar year, which also throws a lot of people off.
And the amount has gone down as well. I think that was an election promise or something, but the amount that you have to spend is lower than it was. Yeah.
Actually, I do think I might even have that tab open. There we go.
Yeah.
I did think ahead about something. So yeah, it's down to $244.80 for concession card holders. So apologies if that's a bit small for folks, but $244.80 for concession card holders. So that's for those on a fair few medications. That's
So
fairly
36 prescriptions. So if you and your family are sort of, if you're getting more than 3 a month, then it's kind of worth starting to keep track. Yeah.
Yeah. And about 1,500 for general patients. So it's decreased a fair bit, which will make quite a lot of difference for particularly families. So there we go. Another thing to remember.
And yeah, you do all need to be on the same Medicare card. Yes, that's the family. Everyone on the same Medicare card. Yeah.
Absolutely. And another thing is that people might not be aware, if they are on private health insurance, of the rebates they may be eligible for. You may just call your health fund and ask about it, because sometimes it's hidden in the fine print. Even I found out that some of my meds were eligible. Those that aren't on the PBS may be eligible for refunds through your health insurance. Did you want to quickly speak to this, Sarah, about some other
sure.
tricks?
Yeah. And some of this slide has actually been built by past seminars that we've given, where people have given us amazing tips. So there may be that we might be able to combine active ingredients into a single tablet. So here I've got a picture of Lipitor and a picture of Norvasc. And so if you were getting them separately, you'd be paying, $6.80 for this one and $6.80 for this one. However, they do come as a combination tablet, which means you only pay $6.80 a month. So there are lots of medicines these days that are available as combinations, particularly medicines for blood pressure, cholesterol, diabetes, they often will combine multiple actives into one tablet. So that's awesome. Instead of paying for 2 tablets, you're only paying for 1. It may be that you're on a medicine that isn't on the PBS, so isn't subsidized, so you're paying full price for it. Now, prices in pharmacies vary wildly. So don't just take the first price that you get. If it's a non-PBS medicine, shop around, and often, online or Chemist Warehouse tend to be the cheapest. And often you can take the Chemist Warehouse price to your local pharmacy if you like them, and they'll often price match. It does suck that you have to shop around and ask for a better price, but you can do that for things that aren't subsidized on the PBS. We do have patients who maybe they're on 150 milligram dose and they get prescribed a 300 milligram tablet and take half. So instead of 1 month, their box of tablets lasts 2 months. That can be a bit tricky because halving things, you want to make sure you get it right, but that's certainly one you can talk to the GP about. Can they prescribe a higher strength, and can you cut it in half and then save a bit of money that way? And also, there are some medicines that do attract a brand price premium, so you pay a bit extra to get that brand. So it may be asking, again, that almost that generic, is there a cheaper brand available? Or if you are getting something that's not on the PBS, is there a product that's on the PBS that might do the same job, and then you can get it subsidized? So just some kind of really general quick ways to try and save some money on medicines, because they're not cheap.
Greg. Oh, you're on mute. Greg, you're on mute.
I'll just add from the perspective of disability that it's often recommended by some that if you're going on a step up or a step down path for a medication, that you double or certainly extend the time frame and reduce the size. So rather than 100 mils, you give 50 for 2 weeks rather than 100 for 1 week or whatever. Yeah. So this staging of withdrawal or addition should be much smaller, particularly. And whether it's a pharmacological phenomena or because of behavioural responses to the medication, it's not really important, I suppose. But it's often very hard to get them the medications to sort of break into quarters or and to find a way to administer them in those small stages.
Can be tricky. Definitely, if you've got something like that, speak to your pharmacist. Like, it may be that we dissolve a tablet in 10 mils of water and you take so many mils out to get that small dose. There are definitely ways of doing that. Definitely, if you can have a chat to someone, we might be able to come up with a solution. But titrating, moving up and down doses is hard. Yep.
Okay. There we go. So now we're going to move on to how to keep track of all of these medicines, which I think is probably some of the meatiest stuff to talk about here. So running through a few of the ways that people keep track of those medicines is that we'll be talking about medicines lists. So there's hard copies that you could do, of course, old-fashioned on paper, but apps are becoming more and more commonly used, and certainly some pharmacies will even have an app that they prefer to use. Medication organizers, I'll show you a few different ones, and I'd love to hear what you're using. Blister packs, things like Webster packs are the most common brand that folks use. How people use reminders. So in terms of reminders, we certainly hear about people who set them on their phone, but you can also get external devices. I use my Fitbit, and a fair few people will have those sort of watch-based devices if they need something wearable. And then, of course, in terms of keeping track long-term, a lot of your medicines info can go on things like My Health Record, so it's accessible across systems. And it's really important that you have a list that you can take with you when you go to the doctor or pharmacy. It's one of the reasons why a lot of people are moving to apps, because they are portable and they're accessible everywhere. So those are a few of the different ways that we speak about. So I'd like to kind of start off this section by hearing what your clients and folks you talk about use and what sort of gets in the way. I can open this up to a whiteboard, or we can just have a chat depending on how people are feeling. So does anyone want to chime in with what they use, what they've seen used to keep track of medicines? Yeah. Got it. Greg?
Well, I use Webster Packs for my son, but basically he lives alone and we support his care or manage his care with support workers in his home. So they're quite successful, but you still have the odd bumps with them and confusions, and you've got to remind yourself to collect them and such things. But currently it's quite easy because we've successfully got him off a cocktail of medication that he was put up on. He's healthier and we're happier. But yeah, they work reasonably well.
Good to hear. Are there any other strategies organised that people use?
I was just thinking of my mother-in-law actually as an example, that I'm trying to convince her to go to Webster Packs, because at the moment she just has her and her husband's medication all in a Ziploc bag, and she seems to know what's going on. But if anything was to happen to her, no one would know what. And you often will find the little tablets sitting on the dining table at the end of the day that I was supposed to take at breakfast. So I think the Webster Packs are the most amazing thing, especially for people who take lots of different medications, but it's not the same at breakfast as it is at night. Lots of different combinations.
Yeah.
There are the little plastic sort of boxes I use for my sort of blood pressure pills, you know, the little sort of daily boxes. But again, it depends on how aware you are, and I still make mistakes with those, of course. I go for the morning one. So
those daily organisers are great, and you can also get the community pharmacies to pack them for you as well. So maybe you don't want a full Webster pack, but you can actually get them to pack. They're called dosette boxes. You can actually get them to pack those daily organisers as well.
Because I mainly work with people using inhalers, it's more about setting up reminders on their phones or using apps, or even just giving them strategies about what activity do they do every day to remind themselves to take their inhaler. So for one lady, it was putting her inhaler in her coffee cup in the morning, because it was what she did every morning.
Awesome.
She would remember to take it before she had her coffee. So it's sort of always looking at what suits the person and also how important it is to them. Because I think if you don't work out what's the motivation to take their medication, it's really hard for them to remember, especially something with like asthma.
Yeah, that's an awesome one. We have,
those daily organisers and individual organisers like that, there are quite a few varieties of those available. Even, you know, if you're looking at your local chemist or your local pharmacy, they have ones that split them into times of day and so forth. But we also had one of our consumers recommend, I think it was called Dosey. She had this little pouch.
One moment to show it off.
Oh, yes. Yes, one of our consumers recommended this, and C was so enamored that they actually went and picked up their own or ordered it online, I think. But it is just another way that you can organise them yourself into those individual time slots and days.
And I'm not too precious about my personal information, but I ended up getting one. Oh, sorry for the blur, but it's got my 7-day packs in one side, 2 in the other, and then it's got just a general purse which has my inhaler and all sorts of things. So if you're taking a lot, that's a sort of custom solution, and it looks like a purse. So some bespoke solutions as well.
Some people can you know, hesitate with the Webster packs because it makes them feel like a, you know, particularly dependent, or if you're looking for something more stylish, there are options.
Yeah, sorry, I just wanted to add on the Webster pack. I think for me as a support worker, having a Webster pack works actually great for, especially when you're doing handover with other staff. You can actually keep track and see if the patient or the client had their medication or not. So it actually great, especially in my sort of setting of work. Yeah.
It's also very clear if a dose has been missed as well. Yeah.
That's very true. That's very true.
Yeah.
Yep.
Apologies for my haphazard notes on this one, but it's just a bit easier, and I'll just grab a print. Okay, excellent. Got of that. Okay,
I think the other situation where Webster packs can be particularly helpful is if the patient or client is particularly inclined towards forgetting or struggling to keep track of things, like if you have a client with dementia or something similar. It helps them to keep track, and they might feel a little bit more in control with that.
They're also good if clients struggle opening bottles as well. It's a lot easier to pierce a Webster pack than it is to try and open a childproof bottle as well. Yeah.
Absolutely. Yeah. So on Webster packs, I've just pulled up a few examples. We've got those plastic organizers, the Webster packs. Webster packs also come in the bilingual forms. So if you work with people who English is a second language for, they have a whole range of languages now available, which is very helpful. And I can, if I jump in, just acknowledging that we are getting up on time. Oh gosh. Let me switch tabs, please. Sorry, the Zoom button keeps getting in the way. There we go. So we have our regular Webster packs, which are just fairly standard, tell you breakfast, lunch, dinner, and bedtime. They now have a whole variety, including custom ones for Parkinson's, low vision, and the multilingual ones are ones that really should be used more prominently for people who have English as a second language, because they come in, I think they were saying, 21 different languages now. It's gone up since last time I looked. So they're quite useful and available at just about every pharmacy that I've come across as well. Sarah, did you have any comments on the use of those?
No, like, just, I guess, don't think that Webster packs solve every problem in the world. Some clients hate them, some clients love them. If Webster packs aren't working, have a chat to us and see if we can come up with another solution. For some of our families, it's as simple as they put the medicines next to the landline and phone every day. Like, there's so many different ways we can experiment with, but often you come into hospital and they just think, Webster pack, Webster pack, Webster pack. Just, know that there's a lot more options out there, and we hopefully won't force a Webster pack onto someone who doesn't want it. We'll come up with a better solution.
Yeah. And one of the other options that people have told us about, and this one is also, they can be a bit expensive, but they are on the NDIS for those who have funding, is something called a tab timer. And they have a whole range of solutions. The one that I popped on the slide was this automatic pill dispenser that has a few different times a day. And
we used this very successfully a few years ago for a blind patient. So I think the hospital sucked it up and just paid for it. But because we didn't have any other way for this patient to get home independently with their medicines, and so that was a really good solution for that particular client. Yeah.
So, but as I say, they are available under NDIS funding and DVA funding as well. And whilst there's these large fancy ones, there's even the smaller ones that are just do a few different kinds of tablets and give you a timer for each day. So those can be quite useful to help people manage as well. And there's more and more solutions coming up every day. As Sarah says, talk to your pharmacist about those. And yeah, so I'll switch back. So those are some physical organizers. You've seen my Dosey purse thing, which is quite an interesting one. And then, of course, in terms of reminders, we talked about phone reminders, but smartphone apps are becoming more and more of a thing. MPS Medicine Wise, that we've referred to several times, has their own, which I'm quite fond of because it's it also has things like a carer mode. So you can set it up with people's family members and they can look at the medicines and manage them themselves without having to be the person using them. And that's quite useful. It also allows for notes, reminders, that sort of thing, as well as being a list of medicines that you can have with you at all times. And more apps are now tracking people's e-scripts as well, as that's being more and more used. And on the fact sheet, I'll include a link to more information about e-scripts and how those work. And some pharmacies are using their own apps as well. So Capital Chemists around town uses one called MedAdvisor, for example. And a lot of those have functionality like managing your scripts, ordering your medicines within the app as well. So it's worth checking with your pharmacist what they use, what they recommend, because they might have one that will automatically come up with what medicines are in their system for you without much setup. And a lot of them have their inbuilt reminder feature rather than using your own. So were there any questions about those? Okay. One of the things to flag with apps is that a lot of the American apps don't work very well in Australia because our privacy laws don't cross over. So that's why I recommend the MedicineWise app or one of the Australian ones. If you talk to your pharmacist, the American ones tend not to interact with our systems very well. Okay. Oh, sorry, we're a bit further along than I thought. So 10 minutes to go. So on to meds checks and med reviews, unless anyone's got any questions. Excellent. So we'll dig into reviews and checks. So if someone's had a significant medical event or they're on quite a lot of medications, it's a good idea for them to talk to their pharmacist about doing something called a meds check, which is done one-on-one in a pharmacy. So has anyone had experience with one of these or a client that's done one of these? No, okay. So the idea of these is that it's a one-on-one, or of course with you can bring a supporter, that sort of thing, to discuss with the pharmacy what your current meds are, have a review, give them a better understanding of medicines, make sure they're working, and provide you with a bit of an action plan. Sarah, could you speak a bit to how these work?
Yeah, sure. So meds checks, you don't need an appointment. You can just walk into a pharmacy and ask for a meds check. And I just want to highlight, gone are the days where you'll be standing in the middle of a busy pharmacy spouting your private medical information. The pharmacist will take you to a private room to have a chat. And so the meds checks works best when you've got one specific problem. So you're having trouble remembering your medicines, or you're having trouble swallowing your medicines, or you have a question about a side effect of a particular medicine. And so what the pharmacist will do, will sit down and have a chat with you and work out how you're going to solve that particular problem. So it's good when you know you've got a problem and you want to go in and have a chat to them about how to fix it. And what might come out of that is they might do your beautiful medicines list, or they might set you up with the app, or they might give you some information on, how to crush your tablets. Or they might go, I think there might be a better medicine with less side effects, and they can work with your GP to have a look at that. So they're kind of these sort of briefish interventions for a particular problem. That's a meds check. Yeah.
So that's a kind of quick one.
Yeah.
And then you've got this bigger one, which is a home medicines review, which needs a referral from a doctor, an appointment, and a pharmacist comes into the home. So could you tell us a bit about how those work?
Yeah, no worries. So this is where your doctors kind of wants a more holistic view of everything in that you're on, and some specific recommendations with the evidence behind it. So what happens is you can raise this with your GP and they'll say, yep, I think we should send you for a home medicines review. A pharmacist will give you a call and work out a time that they can come and speak to you. I'm not sure what happens with COVID at the moment. I imagine there's a telehealth option, because I imagine lots of people don't want random pharmacists coming into their home at the moment. But what they do is they'll come in and they'll say, right, where are your medicines? And often this involves walking around the house. We go under the bed, we go into the bathroom, we literally pull every medicine we can find in the house, and we sit down and we go through everything one by one. We have a look at what your GP might think a person is taking. We have a look at what a person's taking. We go through what are they for. We make sure we can match up indications. We make sure there's a reason for every medicine. We have a really big discussion about side effects and all those questions. What's important to you, what do you want to get out of this? And then we go away and write quite an extensive report. So we might say, I think that this medicine isn't actually doing anything anymore. I think this medicine might need their dose changed, or actually they've got this condition and it's not being treated. Maybe we should start this medicine. We tend to stop more medicines than we start, and they can take a couple of hours. And so the report that goes back to the doctor is very detailed, and it's backed up with primary literature with evidence for the recommendations that we're making, and then it's up to the GP to sort of action those. It may be that we want to do one and then try another one, but yes, this is a fairly extensive program. And government actually chucks quite a bit of money at it, so there is a lot of evidence that it does work, and so that the money that we spend on this sort of saves people from side effects and saves people from bouncing into hospital. So this would be a better one if you've just are really complex on lots of things, not really sure what's going on. Maybe you've got multiple people prescribing medicines and you just want someone to have a look holistically. And I do know of one particular disability support agency group that is actually trying to get these or are funding these through patients' NDIS plans as well for some of their complex patients too. Yeah.
And I believe, as I understand it, support workers can attend to that along with these.
Yeah. Oh, we love family. Like everyone who manages medicines should be in the room. Yeah. If the client wishes. Yeah.
Yeah. So if the client wishes, and that's something you've discussed with them,
Yeah,
that's the sort of thing.
yeah, definitely, because the information that you guys would give us would definitely help us write our report back to the GP. Yeah.
So it's a really useful.
And there's no, sorry, I wasn't very clear. There's no cost to the patient. The GP gets a payment and the pharmacist gets a payment, but there's no cost to the patient. Sorry. For patients that don't fit the criteria, I know some places are actually doing them separately through NDIS plans. Yeah.
It's a great and underutilized tool. Okay, there we go. So just quickly, as we've talked a fair bit, there's a bit on safe storage of medicines. And these are the sorts of things that do come out in those sort of reviews, those action plans, that making sure that we store our medicines properly, we're avoiding things like humidity and heat for those that need, and making sure that those that need to be kept in the fridge, and checking our use by dates regularly. That is one thing with using things like medicines organizers, that people can lose track of those. So those sorts of things that need to be noted. And Sarah, was there anything that you wanted to flag around storage, common issues you might see?
Yeah, just really check where you are storing. I mean, storing them in the glove box of your car is usually the one we see. In Canberra, it can, get to 50 degrees in your car. That's going to do something to the active ingredient, and it means that they might not work. So just be really careful about where you store them. I know lots of people like to put things in the fridge and keep them all together. There are some things that shouldn't go in the fridge. So again, on that CMI, right down the bottom, there's the storage information. So there's always a way of finding out how you should store your medicines. Yeah.
That's one to keep track.
And I think, and the only other thing I was going to say is just be really careful with medicines. I think there's a slide coming up. Medicines look very attractive, bright colors are very attractive to small children. So be careful with medicines in handbags and, in open spaces as well.
I think that will be up in a sec. Yes.
Yeah. Okay.
Sorry, things have shuffled a little bit. And just quickly, we spoke a fair bit about side effects, and this is the information about reporting a side effect. I'll send out the slides with this, but I won't dwell on it too much. The TGA does like to keep track of these. You can report them, GPs can report them, pharmacists can report them, and you can provide information. But really, if one is taking place, speak to a health professional straight away. If you have expired medicines, those things that need to be disposed of, there is a scheme called Returning Unwanted Medicines, which is happening in pharmacies. There are bins at pharmacies to dispose of medicines. Those certain things can't go in those, so things like sharps. And it's important that we do clear out our medicines when they expire, that sort of thing, because this sort of
there we go.
There we go.
We did this for a bit of fun a few years ago for a presentation we were doing, but basically you can see in each line, one of them's a lolly and one of them's a tablet, and a lot of the time they look very, very similar. And certainly you wouldn't want to get your Mentos mixed up with your sodium valproate, which is quite a hardcore medicine we use for epilepsy. So yeah, definitely don't want to get them mixed up, but they do look really pretty and really attractive. So yeah, just a reminder to be a bit careful, particularly if you've got grandchildren around. Yep.
It's a very big one. So just the reason I've rushed through that last bit is I really wanted to show off some of these resources. There are some great guidelines to help people out working in the sector. This one from the Australian Community Industry Alliance, the new version is unfortunately behind a paywall, but I can share the older version, which will go out afterwards. And this Department of Health Guiding Principles for Medication Management in the Community. It is from 2006. It's quite old, but it is being updated currently and contains some kind of key guidelines around how medicines are supposed to be managed within community if you're not necessarily, you know, a registered nurse working in the sector. So the community worker sort of level, those sort of safety things. But these ones are really quite good. The NDS Learning Guide for Disability Workers, again, it's a bit of an older one. It's from National Disability Services. It was attached to it was previously attached to a unit of competency. Now it's just really a standalone resource that'll give you a lot of what we've covered today, but also some useful things around dosages and the sort of tools that people have used. Of course, we're not really talking about administering medicines yourself here. It's more about equipping your clients with the tools, but there's a lot of useful things about how to calculate medicines, looking for the expiry dates, that sort of thing within this document. So I'll share that as well. It's quite a useful and free resource out of National Disability Services. And another one that I find quite useful, if I can get to the tab, is this Me and My Medication Easy English resource from the Council for Intellectual Disability, and their health resources in general are great if you're working with people with intellectual disabilities or communication disability. And that is all in easy English, and it explains a lot of the questions that we went through earlier that they should be asking around their medicines, things about what a script looks like, what it will include, even that information broadly around generics, all in easy English with graphics, that sort of thing. So I really encourage you to look at those tools. Again, I'll send them all out in an email this afternoon. So if I can get back, there's those. We've also got some great information about where you can go for help. The NPS site, the National Prescribing Service, that Medicine Finder. They've also got really useful fact sheets and the app, of course. Your pharmacist should be your first stop for questions, or your client's pharmacist. And they can help you out, of course, if you're concerned about those things like side effects, those issues. There's also the medicines line here to ask questions around medicines as well. And then Health Direct is a really useful tool if someone's unwell and you're not sure what it is, what's going on, and you're not sure how serious it is. They can answer a lot of questions. It's manned by registered nurses. So that's a really useful tool to have in your tool belt. They do also have an app, and that has useful things like the questions that I had earlier around what you need to ask when commencing a new medicine. So another useful tool. And there's my details. If you have any further questions, you can ask us that. Check us out online for further resources, and we'll hopefully be running more sessions like this. And Caitlin will pop a little feedback link in the chat, so you can give us some feedback on today, any tips or any sessions you want to hear more from us about. We can grab another health topic and talk about it further. We'll also be doing more about health literacy later in the year and how you can support people to get more out of the health system. So I will stop sharing, and just, if there are any questions, acknowledging we're a little bit over time, and just if there's any questions before we go. Not getting any for everyone. I hope that you got something out of today and it hit the mark for you. I'll just check. Excellent. Okay, well, I'll let you all go, and I hope that this was useful for you all. And yeah, thank you so much, Sarah, for sharing your knowledge.
No, thanks everyone. Thanks for coming. Yeah.
Have a good one. Bye.